Hi guys, and welcome to today's episode of the vlog series. Today we're going to talk to you about the role of an intensivist and what that looks like in the NHS. Okay, so the role of an intensive care medicine doctor, often known as an intensivist in the NHS, is to manage patients who are at risk of, currently have or are recovering from potentially life-threatening conditions that relate to any failure of the body's organs. The most common route to becoming an intensivist in the NHS is to go through either EDIC or EDIC, although because it's quite closely linked to medicine sometimes and the medicine specialities, it's possible to come through the MRCP route as well. Plaid doctors may be obviously viable for more junior positions in the role as well. Okay, so what should you expect as an intensivist in the NHS? Well, first and foremost, it's one of the specialities that's got close links across the hospital. So you may well find yourself working with other doctors from trauma, from surgery, from medicine, from ED as well. So if you're interested in working in a very much a multidisciplinary team, then it's definitely the one for you. It's also an incredibly busy and varied role. Obviously the name itself suggests that it is an intense working environment. You typically would be dealing with between 8 and 25 patients. The more specialised the ward, usually the lower the number of patients that you're actually dealing with. And the type of patients that you're going to see will vary considerably. So it could be anything from lethal poisons to very bad asthma attacks, cardiac arrests, and respiratory failure, anything along those lines, through to major traumas as well, so head injuries, road traffic incidents, and people recovering from those too. So you're dealing with a whole host of medical specialisms as well as a whole host of different patients. It's a very, very varied position in the NHS. Okay, so can you specialise in intensive medicine? The answer is yes, you can. It wouldn't be a recognised specialism on the specialist register for the GMC. That would just be intensive care medicine, but you can develop subspecialist interest within that. So all of the usual things that get covered off. So you could be a specialist in neuro for head injuries. You could be a specialist in paediatrics, of course. And one that's of course very, very prevalent at the moment is being a specialist in respiratory, and obviously the intensive care medicine that goes alongside that. And accompanying that, where will you be working? Well, some hospitals do have specific intensive care units that you may be based in. Although if you're a subspecialist in some other fields, you might find yourself in a high dependency unit for paediatrics, for example, or spending time on a cardiac ward or something along those lines as well. So you really could be thrown in at any part of the hospital. You'd be expected to rotate amongst those and help out in those different fields as well if you're a generalist. Okay, so hopefully that's been of some use in telling you a little bit more about intensive care medicine in the NHS. If you do have any questions about it, please feel free to get in touch. And if you're an intensive care doctor and you're looking to relocate to the UK, then please send us your CV. We'll put the contact details up at the end of the video.